Completely clear. If your urine looks like tap water, congratulations. You technically didn't drink too little. You drank too much. Sounds backwards, right? Here's what's happening. Your kidney's whole job is to filter your blood and concentrate the waste into urine. When you flood your system with more water than it can actually use, the kidneys basically throw their hands up and let it all pass through unprocessed. In everyday life, this isn't a big deal. It just means ease up on the water bottle. But take it to the extreme. Think marathon runners chugging water every mile, or people doing water challenges, and you can actually dilute the sodium in your blood to dangerously low levels. That condition is called hyponatremia. So no, clear pee isn't the hydration trophy you thought it was. It's actually a yellow flag. Pale yellow. This is the one. If your urine could get a gold medal, this is it. The pale, light straw yellow color doctors actually want to see on a test strip. Here's the fun science behind it. Your red blood cells only live for about 4 months before your body recycles them. And part of that recycling process creates a pigment called urochrome, which is literally what gives urine its yellow color in the first place. When you see this soft, pale shade, it means you're hydrated just enough that the pigment isn't too concentrated and not too diluted. Basically, your kidneys are chef's kiss balanced right now. Dark yellow. Okay, darker yellow, same pigment, just less water diluting it. Think of it like orange juice concentrate versus orange juice mixed with water. Usually this just means, hey, maybe grab a glass of water, nothing dramatic. But here's a detail that trips a lot of people up. Your first bathroom trip of the morning is almost always going to be darker, even if you're the most hydrated person on Earth. Why? Because you've just spent 7 or 8 hours asleep without drinking a single sip. Morning pee is basically concentrated overnight backlog, so don't freak out about it. Just check again a few hours into your day once you've actually had some water. Amber or honey-colored. Now we're stepping it up a notch. If your urine looks like it belongs in a bottle of beer rather than a toilet bowl, your body is waving a small flag at you. Amber means dehydration has gone from mild inconvenience to actually measurable. Your blood volume drops slightly, your heart has to beat a little faster to keep things moving, and your kidneys are working overtime trying to hold on to every drop of fluid they can. This is exactly why athletes, hikers, and people who work outside in the heat are trained to treat this color as an actual checkpoint, not just a suggestion. If you see amber, don't wait until tomorrow. Grab water now. Orange. This urine is where things get genuinely interesting, because there are 2 totally different explanations and one of them is a lot more chill than the other. The harmless version, you might have just eaten a ton of carrots or other beta-carotene-rich veggies, or you're taking certain medications, which is basically famous for turning your pee traffic cone orange. The less chill version, orange can also mean bilirubin, a pigment your liver is supposed to process and dispose of properly, is instead leaking straight into your urine. If you notice orange urine at the same time as pale, chalky-colored poop, that combo is actually a real signal that your liver or bile ducts might need some attention, so that's worth mentioning to a doctor. Pink or red. This is the color that makes everyone panic. And look, sometimes that panic is justified. Blood in the urine is a legit medical cause and shouldn't be ignored. But before you spiral, know this. Beets are famous for turning some people's urine pink or red, a phenomenon that actually has its own official name, beeturia. And here's the weird part. It doesn't happen to everyone. Whether beets turn your pee red depends on your individual gut bacteria and how well they break down the pigment. So your friend can eat the same beet salad as you and have 0 color change while you're suddenly seeing red. Certain laxatives and chemotherapy drugs can cause a similar tint too. The rule of thumb that actually matters here. Painless red urine that shows up once, especially after eating something like beets, is usually nothing to worry about. Red urine that comes with pain or sticks around for more than a day is the kind that needs an actual doctor. Blue or green? Yes, this is real. And yes, it sounds like something out of a cartoon. Certain medications, including some anesthetics and antidepressants, can genuinely tint your urine blue or green as a totally harmless side effect. There's also an extremely rare genetic condition, sometimes nicknamed blue diaper syndrome. where a defect in processing a specific amino acid turns an infant's urine blue. And in hospitals, certain urinary tract infections caused by specific bacteria can create a blue-green tint from a pigment those bacteria produce. Despite how alarming it looks, and it does look alarming, blue or green urine is almost never dangerous on its own. It's basically the human body's way of showing off. FOAMY, or bubbly. A little foam here and there is completely normal. It's really just air mixing into the stream, especially if you've got a strong flow going on. What actually matters is whether that foam sticks around. Foam that disappears within a few seconds is nothing to think twice about. But foam that's thick, persistent, and shows up trip after trip, day after day, can be an early sign of protein leaking into your urine, called proteinuria. This usually means the kidney's filtering system, made up of millions of tiny units called nephrons, isn't screening things out the way it's supposed to. The sneaky part is that persistent foamy urine can be one of the earliest detectable signs of chronic kidney disease, sometimes showing up years before any other symptom does, which is exactly why it's worth paying attention to if it keeps happening. Brown or cola-colored. Okay, now we've reached the stop scrolling and pay attention zone. Brown or cola-colored urine is not something to shrug off. It generally points to one of two things: severe dehydration that's concentrated the urine to an extreme degree, or a liver problem causing bilirubin buildup, the exact same pigment responsible for that yellowish tint you see in jaundice. But there's a third cause worth knowing, and it's a big one: a condition called rhabdomyolysis, where extreme muscle breakdown floods your bloodstream with a protein called myoglobin, turning your urine the color of a dark cola or strong tea. This can happen after brutal workouts, crush injuries, or certain drug overdoses, and if it's left untreated, it can actually cause kidney failure.